CSL helps to reduce the cost of NHS administration. It helps to improve the value for money, the efficiency of the NHS. Over the last 2 years, we've worked hard with staff from primary care trusts to improve their skills. Over the next year, we'll be working increasingly with GPs, helping train them to develop the full commissioning and commercial skill set that they need.
The Coalition Government have asked GPs to take a lead in the commissioning of health services. GPs know their patients really well, they know their population, but that does not make them a good commissioner. To be a good commissioner, you need certain skills, a training plan, and CSL can help me and my GP colleagues to be trained to become good commissioners. We need to look at the evidence of patient care, the evidence around clinical care pathways, the evidence around GP engagement, making sure the public health analysis is done properly. That should and could be done London-wide. CSL is perfectly placed to deliver that for London.
CSL helps drive better value for money by working closely with commissioners. Our claims management and contract monitoring systems help commissioners to monitor and challenge hospitals in delivering their activity.
CSL looks at lots of different initiatives to try and save money for the PCTs and for the sectors. One of those initiatives that we have been involved with is claims management. We validate the £9 or £10 billion worth of acute activity which happens across the capital each year. We do a series of logic checks to make sure that the data quality is right. What we're also looking to extend that service is actually getting the activity into the hands of GPs and clinicians so that they can start looking at the appropriateness of care and seeing if we can actually change the care setting from perhaps the very expensive acute into places like community where the outcomes actually are much better.
We're also developing modelling tools that will help commissioners and increasingly GPs model future demands in patient activity, and that will help them commission the right services for patients in the future, driving up standards of care and making sure that care is provided in the right location.
What we've been doing in Bexley is really promoting practice-based commissioning, giving GPs responsibility for the services that are commissioned on behalf of their patients. The population health management tool will really enable those clinical commissioners to move on to the next level and take a real lead in the way that the NHS commissions services on behalf of its population.
We improve commissioning skills in London by helping to train commissioners to help them develop the full skill set that you need to commission services properly.
CSL has really helped me in developing commissioning skills in a number of ways. Firstly, in helping support my development of our strategic plan through the Improving Families workshops and with other commissioning colleagues. And secondly, through the development of the individual commissioning competencies which are on the website, which has enabled myself and my team and other colleagues within the PCT to improve our commissioning skills.
Last year, CSL worked with clinicians and patient panels to propose service changes that are expected to save hundreds of lives amongst stroke and major trauma patients in London. We're now putting forward similar proposals for cardiovascular and cancer services.
My name's Amanda Pitt-Brown. I was 33 when I had my first massive stroke. One morning I woke up and apparently no one could understand what I was saying. I was talking in gobbledygook. I couldn't walk, I couldn't do anything. I was taken to Chelsea and Westminster Hospital, which is a stroke unit. They are the most brilliant people. I feel really grateful for what they did. I mean, I know it was a normal day's work for them, but for me it was giving me my life back.
So these are exciting times. The NHS is changing and CSL is at the forefront of that change. We're really looking forward to increasingly working with GPs to help them commission true value for money services that help improve the patient experience of the NHS.